Hi, you guys. Welcome back for our daily practice questions. It is day 190 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description so that you can see all of the resources that are housed for first-time test takers, students, and those who are retesting. Also, if you're looking to join the upcoming 5-week intensive review for FNP and AGNP reviewers preparing for the ANCC as well as AANP exam, my class starts August the 11th and runs through September the 12th. Early bird enrollment is still open until July the 14th to save $100. All right, you guys, question number 1. A 23-year-old woman tests positive for chlamydia. What is the first-line treatment per CDC guidelines? Is it A, ceftriaxone 500 milligrams IM once? Is it B, doxy 100 milligrams BID for 7 days? Is it C, metronidazole 500 milligrams BID? Or is it D, amoxicillin 875 milligrams BID? Take a moment and tell me what you got. All right, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem is the question. The question is the stem, so to speak, but we do have a little extra information with it. But when it's like this, I kind of combine the two. But the stem here is, what is the first line treatment per CDC guidelines? And the other sentence says, a 23-year-old woman tests positive for chlamydia. Now, I always tell you, if they're looking for a treatment, to look and see if they provided you with a diagnosis, right? And so they have. Chlamydia is the diagnosis. So then you need to think about first line therapy for chlamydia. Remember, first-line therapy for chlamydia is doxycycline and azithromycin, right? With doxy now being the top of that first-line therapy because azithromycin is what? It's your Z-Pak, right? And so there are forms of resistance towards this because it's so commonly utilized. So B is your best answer, doxy, 100 milligrams BID for 7 days. All right, question number 2. A 24-year-old man tests positive for gonorrhea. What is the first-line treatment? Is it A, ceftriaxone 500 milligrams IM once? Is it B, doxy 100 milligrams BID for 7 days? Is it C, azithromycin 2 grams PO once? Or is it D, Cipro 500 milligrams PO once? Take a moment and tell me what you got, y'all. All right, so the stem of the question is, what is the first-line treatment? And they have provided us with a diagnosis. It's gonorrhea. So what is first-line treatment for gonorrhea? It is A, ceftriaxone 500 milligrams IM once. Make sure you know your first-line therapy options, okay? And then lastly, question number 3. A 36-year-old woman presents with frothy yellow-green discharge and a strawberry cervix. What is the first-line treatment? Is it A, doxycycline? Is it B, metronidazole 2 grams PO once? Is it C, azithromycin 1 gram PO once? Or is it D, fluconazole 150 milligrams PO once? Take a moment and tell me what you got in the comments, y'all. All right, and stem of the question here states, what is the first line treatment? So again, we're looking for a treatment. So you need to run it back and see if they provided you with a diagnosis. They have not in this scenario, so we're going to run it back and look at the assessment findings, right? Because we got to know what it is to be able to treat it. So we have a 36-year-old female that comes in with frothy yellow-green discharge and a strawberry cervix. Again, I tell y'all key identifiers, right? Make sure you know them. And I always say, with my Britney's brilliance, when I say this, you say that. So when I say strawberry cervix, you should say trichomonas, right? And then you need to think about how we treat trichomonas. So first line therapy for trick is B, metronidazole, 2 grams PO1s. All right, you guys. As always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And as I mentioned earlier, my website is also linked in the description of this video, and it houses all of the resources that I offer. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.